Greetings, Dr. Law, faculty, staff, and fellow students. My name is Virlyn Dodge, and I'm a Master of Public Health student with an emphasis in nutrition at Liberty University's online program. The following PowerPoint and video presentation are to fulfill Health 698 final project presentation. My practicum project was to conduct a retrospective formative evaluation of Healthy Alaskans 2020, which is Alaska State Health Improvement Plan. I feel so privileged to have worked with Healthy Alaskans 2020. Throughout all of my Master of Public Health courses, I relied heavily on the most current Alaskan health statistics. This allowed me to contextualize the information I was learning in a real way. Because Healthy Alaskans 2020 produces yearly updates of its 25 leading health indicators, it was naturally my go-to resource for health statistics of Alaska. Before I delve into the details of this practicum project, it's important to give a brief overview of Healthy Alaskans 2020, and from this point on I will be using its acronym HA 2020. Next slide, please. HA 2020 is the third iteration of Alaska's State Health Improvement Plan and introduces three unique features from all other state health improvement plans. The first is a collaboration between Alaska's State Department of Health and Social Services, DHSS, and Alaska Native Tribal Health Consortium, ANTHC, which is also the largest and most comprehensive tribal health organization in Alaska. HA 2020's team organization is led by the initiative's co-chairs, one person from DHSS and one person from ANTHC, and is composed of a five-tiered pyramid structure consisting of the steering team at the top, followed by the core team, data and communication teams, advisory team, and the community of interest. Also unique to previous state health improvement plans is HA 2020's shared measurement framework, consisting of only 16 objectives and 25 leading health indicators, each with established targets to achieve by 2020. Finally, the leadership team wanted HA 2020 to be implemented in the community. For this reason, utilizing the collective impact model for social change, an evidence-based strategies and actions document was developed consisting of 75 strategies and 166 action steps assigned to the 25 leading health indicators. Before I continue, I would like to also point out that although working with HA 2020 did not give me an experience specific to my nutrition emphasis, I was able to get an in-depth experience into the health indicators most important to all of Alaskans. The majority of these are also directly related to nutrition, for example, cancer, obesity, mental and dental health. And of course, all health is supported and enhanced by good nutrition. More importantly, this opportunity allowed me to experience public health from the State Department and tribal health perspective. Next slide. My task for this project was to conduct a systematic assessment of HA 2020's framework. The purpose of the assessment was to identify the strengths and areas for improvement in the structure and process, or the infrastructure, of HA 2020. The focus was to be specifically on the initiative's team structure, their roles, and the flow of communication, both internally and externally. My first assignment was to create the evaluation plan and present it to the evaluation team. This team was composed of the co-chair, a health scientist, an epidemiologist, and the director of a tobacco prevention program. I met with this team 6 times over the course of the project. Each member was invaluable in not only lending their expertise, but in their support and encouragement of me personally. Next slide. The methods I utilized include a logic model, literature review and historical perspective of the initiative. This included a review of the history of healthy people, an in-depth look at all 50 state health improvement plans, and of course, the history of Healthy Alaskans. I designed and developed a key informant interview, and 14 key informants were identified. I conducted all 14 key informant interviews in person. Each interview was recorded and transcribed. Finally, I developed an online survey using SurveyMonkey, and this was emailed to the advisory team members. 15 of the 29 invited completed the survey. The research design of this evaluation was, of course, qualitative research, and inductive content analysis was utilized when reviewing all data. Next slide. Before I review a synopsis of the results, I need to review a primary theme that emerged: the role that the collective impact model played in the development and infrastructure of Healthy Alaskans 2020. The impact is seen most clearly with a side-by-side comparison of the collective impact model. You see this model on the left and the implementation framework for HA 2020, and you see the steps on the right. Very briefly, the collective impact model was first introduced in 2011 and is composed of 5 essential elements that can be used to solve complex social and health problems. It was introduced as a solution to organizational silos and requires a shift from individual, independent efforts to structured, collaborative efforts to reach system outcomes. Because the interview and survey questions were designed to gather information on the structure and process of HA 2020 based on the experiences of the participants, the themes that emerged aligned with the 5 elements of the collective impact model. A summary of all participants' answers was categorized under the 5 elements. Finally, it was important to HA 2020's leadership team to understand the strengths and the areas for improvement within each element of the initiative. Next slide. I can only provide you with a very brief summary of the results of this evaluation, but as part of the project, I will be presenting a 30-minute PowerPoint presentation of the results to the advisory board during their May meeting. The partnership between DHSS and ANTHC was identified as HA 2020's greatest strength by 100% of all participants. The majority of participants also felt that there was strong internal communication. And all were very proud of the fact that HA 2020 produces a yearly update of the 25 leading health indicators. This is unique to all other state health improvement plans and Healthy People, which only produce a mid-course and a final report at the end of the decade. The areas for improvement include the development of an implementation plan, an implementation team to monitor and facilitate implementation in the community. The majority of participants identified external communication as a weakness in the initiative. Monthly advisory team meetings were suggested as a way to improve external communication. As a result, the HA 2020 co-chairs have implemented monthly advisory team meetings. Finally, evaluation was not part of the original HA 2020 plan, and this is certainly an area for improvement in the next State Health Improvement Plan. Next slide, please. There are several limitations to this evaluation. The first is the very short time frame to complete the evaluation, less than 4 months. Secondly, information was hard to find. HA 2020's historical information is not centralized or readily available. Because the evaluation nor a logic model was part of the original initiative, what was done in this evaluation did not have the benefits of lessons learned from previous evaluations. Unfortunately, the population used in this evaluation was very small. Only 29 people were interviewed or responded to the survey. Although results cannot be generalized based on the small population, it is hoped that this evaluation will serve as a starting point for future evaluations. Finally, I'm a novice evaluator, and this was my first time conducting this type of evaluation. In spite of the limitations in this evaluation, many of the short-term and interim outcomes presented in my project logic model did produce positive outcomes. I was able to gain a historical knowledge of HA 2020 and increase awareness of HA 2020 within DHSS and ANTHC departments. The evaluation produced a list of strengths and areas for improvement. Finally, there was an increase in advisory team participation, culminating in the monthly advisory board meetings. Final slide. In conclusion, one of the most important outcomes of this evaluation to the leadership team was that I compile a list of recommendations to be presented to the Healthy Alaskans 2030 Planning Committee for consideration. The following is a brief list of some of the recommendations. Improve the website, increase financial resources, increase public engagement, highlight 3 to 5 objectives for the purpose of implementation, develop culturally relevant strategies and actions for each of the leading health indicators, build in evaluation to every aspect of HA 2030, have a big finish and acknowledge successes, have a big launch in January 2020 with a clear plan for Healthy Alaskans 2030. This concludes my project presentation. I'm very grateful for all I learned, the connections I made, and the opportunity to experience public health from the state and tribal administrative levels. Thank you for listening.